Alzheimer's by Ashley Pogue, Billy Dorflinger, Nate Rodriguez, and Nicholas Andrade.
Alzheimer's is an irreversible, progressive brain disorder that slowly destroys memory and thinking skills. Abnormal deposits of protein form plaque throughout the brain and causes neurons to stop functioning, lose connections with other neurons, and die. Neurons transmit messages between different parts of the brain and from the brain to muscles and organs in the body. Alzheimer's is a slow disease that progresses in 3 stages: an early preclinical stage with no symptoms, a middle stage of mild cognitive impairment, and a final stage of Alzheimer's dementia. Dementia is a loss of cognitive functioning, thinking, remembering, and reasoning, and behavioral abilities. Although treatment can help manage symptoms in some people, there is no cure for this disease. Incidence. Studies have shown that more women than men are diagnosed with Alzheimer's disease and other dementia. Almost 2/3 of Americans with Alzheimer's are women. Alzheimer's is the 6th leading cause of death in the United States. Currently, more than 5 million Americans are living with Alzheimer's. Every 66 seconds, someone in the United States develops this disease. The number of Americans living with Alzheimer's disease is growing, and growing fast. An estimated 5.4 million Americans of all ages have Alzheimer's disease in 2016. Statistics show that 1 in every 3 older people dies with Alzheimer's or another dementia. For caregivers or those who not put their loved ones into an assisted living facility, it takes a big financial and personal toll. It is estimated that caregivers provide 18.1 billion hours of unpaid care, and they spend more than $5,000 a year to care for someone with Alzheimer's. Older Hispanics and African Americans are more likely than older Caucasians to develop Alzheimer's disease. A review of many studies by an expert panel concluded that older African Americans are about twice as likely to have Alzheimer's and other dementias as older Caucasians, and Hispanics are about 2.5 times as likely to have Alzheimer's and other dementias than older Caucasians. Instead of genetic factors, health conditions such as high blood pressure and diabetes that may increase one's risk for Alzheimer's disease or any other dementia are believed to account for these differences because they are more prevalent in African American and Hispanic people.
Etiology or the cause of a disease. Alzheimer's is caused by the buildup of plaque in the brain. These plaques are made of amyloid beta protein and lead to vascular damage and nerve cell death. Alzheimer's also has a genetic component. It is known to be associated with chromosomes 1, 14, and 21. However, just because a person is genetically predisposed to Alzheimer's does not mean they will ever develop the disease. Pathophysiological consequences. The APP gene is associated with Alzheimer's. Mutation of this gene leads to the production of the amyloid beta protein plaques. The plaques cause cell death because amyloid beta protein is toxic to the body. It can also disrupt calcium homeostasis. One nerve cell that can degenerate due to Alzheimer's is the acetylcholine-releasing neuron. This may play a role in memory loss. How does all of this relate to physiological concepts from class? We know that neurons carry signals throughout the body and brain. Plaque buildup and cell degeneration inhibit the function of these neurons. Second, memory loss or dementia is a symptom of Alzheimer's. Short-term memory occurs in the hippocampus and amygdala, while long-term memory is associated with the prefrontal cortex. Plaques and cell death can halt the memory processing functions of these areas. Last, the buildup of amyloid beta protein alters calcium homeostasis. Calcium is needed for an action potential to travel from neuron to neuron. If this process is obstructed, a multitude of malfunctions within the brain could arise.
The signs and symptoms of Alzheimer's are expressed differently from one patient to another, and this is primarily because there are several different factors that can cause Alzheimer's. A major symptom of Alzheimer's is memory loss. When a patient exhibits memory loss, he or she may repeat statements, get lost in familiar places, forget conversations, and in an extreme case of Alzheimer's, a patient may forget the names of family members. Another symptom of Alzheimer's is difficulty in thinking and reasoning. A patient may find it very hard to think about abstract concepts, such as numbers, and may not even understand the concept of numbers in extreme cases. In some cases, Alzheimer patients may have a change in personality, which can result in depression, social withdrawal, mood swings, wandering, and loss in inhibitions. Medical treatment for Alzheimer's is not always straightforward. In fact, treatment usually consists of pharmacologic and non-pharmacologic methods. Because Alzheimer's has no cure, the primary focus is to maintain the quality of life, enhance cognition, mood, and behavior, promote a safe environment, and facilitate social engagement. To obtain these treatment goals, there are essentially 5 major drugs: Namzaric, Exelon, Razidine, Aricept, and Namenda. As stated earlier, Alzheimer's is a progressive disease that is not reversible, so it needs to be continually monitored in order to make sure that the treatments are working. If, however, they are not working, then generally changes can be made to obtain the treatment goals.
The symptoms of Alzheimer's worsen over time, although the rate at which the disease progresses varies. The most common early symptom of Alzheimer's is difficulty remembering newly learned information. Serious memory loss, confusion, and other major changes in the way our minds work may be a sign that the brain cells are failing. People with memory loss or other possible signs of Alzheimer's may find it hard to recognize they have a problem. Signs of dementia may be more obvious to family members or friends. Anyone experiencing dementia-like symptoms should see a doctor as soon as possible. Early diagnosis and intervention methods are improving dramatically, and treatment options and sources of support can improve quality of life. In the early stage of the disease, the patient may function independently. He or she may still drive, work, and be part of social activities. Despite this, the person may feel as if he or she is having memory lapses, such as forgetting familiar words or the location of everyday objects. Friends, family, or neighbors begin to notice difficulties. During a detailed medical interview, doctors may be able to detect problems in memory or concentration. Common difficulties include problems coming up with the right word or name, trouble remembering names when introduced to new people, having greater difficulty performing tasks in social or work settings, forgetting material that one has just read, losing or misplacing a valuable object, and increasing trouble with planning or organizing. The middle stage is typically the longest stage and can last for many years. Patient confuses words, gets frustrated or angry, or acts in unexpected ways, such as refusing to bathe. Damage to nerve cells in the brain can make it difficult to express thoughts and perform routine tasks. At this point, symptoms will be noticeable to others and may include forgetfulness of events or about one's own personal history, like being unable to recall their own address or telephone number or the high school or college from which they graduated. Feeling moody or withdrawn, especially in socially or mentally challenging situations. Confusion about where they are or what day it is. The need for help choosing proper clothing for the season or the occasion. Trouble controlling bladder and bowels in some individuals. Changes in sleep patterns, such as sleeping during the day and becoming restless at night. An increased risk of wandering and becoming lost, and personality and behavioral changes, including suspiciousness and delusions or compulsive, repetitive behavior like hand-wringing or tissue shredding. In the final stage of this disease, individuals lose the ability to respond to their environment, to carry on a conversation, and eventually to control movement. They may still say words or phrases, but communicating pain becomes difficult. As memory and cognitive skills continue to worsen, personality changes may take place and individuals need extensive help with daily activities. At this stage, individuals may require full-time around-the-clock assistance with daily personal care, lose awareness of recent experiences and as well as of their surroundings, require a high level of assistance with daily activities and personal care, experience changes in physical abilities, including the ability to walk, sit, and eventually swallow, have increasing difficulty communicating, and become vulnerable to infections, especially pneumonia. Alzheimer's is diagnosed through a complete medical assessment. There is no single test that can show whether a person has Alzheimer's. Diagnosing Alzheimer's requires careful medical evaluation, including, first of all, a thorough medical history. The doctor will want to know about any current and past illnesses, as well as any medications you are taking. The doctor will also ask about key medical conditions affecting other family members, including whether they may have had Alzheimer's disease or related dementias. Also, mental status testing, a physical and neurological exam, and other tests such as blood tests and brain imaging to rule out other causes of dementia-like symptoms. Finally, experts estimate a skilled physician can diagnose Alzheimer's with more than 90% accuracy. Thank you.